Hello everybody, this is Paul from Ortho, Eval, and we have Claire. Now I'm going to give you the answer to our mystery shoulder diagnosis, okay? So earlier you noticed that she had a positive near sign, positive Hawkins-Kennedy, and she also had very limited internal rotation. So this is what's going on. Her posterior capsule is very, very tight. Now remember in the evaluation, when I asked if she had any medical conditions, she said that she had hypothyroidism. Almost every one of my frozen shoulder patients have a thyroid issue. Now, she doesn't have the positive capsular pattern, which everybody's going to say, well, she doesn't have a capsular pattern, it can't be adhesive capsulitis, but you can have tightness of a certain part of the capsule, and in her situation, it's the posterior capsule. So when I try to internally rotate her, she doesn't internally rotate very well. You see the shoulder elevate, she has some inferior capsular tightness also. So inferior and posterior capsules are tight. When that happens, it forces the humeral head anteriorly, and when that occurs, you develop more impingement, subacromial impingement. So we can't identify if it's the bursa, the bicep tendon, or the rotator cuff. She has good resistance to her rotator cuff, so she has good integrity of her cuff, and it doesn't hurt her. So I don't really think her cuff is significantly involved. But I think she's developed a subacromial impingement because of the tight posterior capsule. So a little adhesive capsulitis causing anterior shoulder impingement. Now we had done just one treatment with you. We stretched the posterior capsule quite a bit. We heated you up, and we did some mobilization to the shoulder, and you had no problem with that, right?
No.
Okay, good. So we're going to continue in that direction. Our goal is to improve her internal rotation without causing impingement. And she is going to do excellent. I know she will. We see nothing else going on. Now, as far as red flags go, always be concerned when a patient says they had mid-brachial pain. Okay? Most people who have pain around the deltoid area, it's coming from the rotator cuff. That's like 95% of patients who have rotator cuff impingement or involvement have pain into the deltoid. But when they say they have isolated mid-brachial discomfort, I always palpate that. I've had 3 patients with multiple myeloma, and this is where the arm actually fractured and or lost bone density and had significant pain in that area. So I always kind of check that, and I ask the cancer questions like we did in the evaluation. So if you have any questions, you know how to get in touch with me now. Good luck, and stay tuned. We're going to have tons more content for you. Take care.